What's up YouTube, Sierra here with LiQWYD, and today is my 6 months post-op from my hip surgery. So I thought I'd give you a little update because I just got to physical therapy, but before this I was at my 6-month post-op appointment with my doctor, Dr. Evanson. Here I am in my x-ray shorts getting ready for them to call me back. X-rays were so easy, and that's the first time I've had to lay down on the flat table and had no pain in my SI joint. So this is very good. Okay, so I had my x-ray and it went really well. Everything looks great. I wish I had a picture of it, but I didn't think to get my camera out while I was in there with the doctor. But we discussed 6 months and how I'm feeling. I told him that I had some soreness in my hip flexor after chasing a chicken down the road, which is a whole different story. And I felt like a pop, but you know, hips pop all the time, so it was really just peace of mind that I wanted to get the x-ray today. But I had the 6-month appointment anyway, so I just figured. We discussed, you know, elliptical and bike that I've been doing. He told me that's not really required anymore, but it's very healthy to do so. So I'm gonna keep doing it, but I'm not gonna feel as regimented about it. And then we discussed yoga as well. I told him that yoga in the past had kind of bothered me, but I really enjoyed it and, you know, didn't know if I could get back into it. He said he was huge into yoga and thought it was fantastic, and that right now the most important thing for me to do, even outside of like working out, is just stretch, because there's scar tissue in there, and that scar tissue, its best fighting chance at like kind of getting out of your system is stretching. So if you're 6 months post-op like me, or you're planning ahead, it's kind of nice to know, you know, that you don't have to be on the bike all the time or the elliptical all the time to succeed, but that like massaging and stretching is really important. If you are on Instagram and you do not already follow Dr. Evanson, you really should. He has a new Instagram called The Hip Doc, and I will link it down in the description below. He has videos on there of him doing surgeries and explaining things, and he is just a wealth of information, and he has completely changed my life for sure. From 3 years of pain to feeling how I'm feeling now is just a miracle to me, and so you should definitely give him a follow. And if you're in the Dallas area, Fort Worth area, Texas even, and you are looking for a hip doctor, I can't recommend him enough. Now I'll go ahead and jump into PT today. So whenever I got there, I told both my PT and the owner of the PT place what Dr. Evanson said. He's actually really good friends with them, and they recommend a lot of people over to this physical therapy office that I adore. And so I gave him the update, told them what he said about not needing to be in PT anymore, but that I wanted to get their best opinion. We decided for me to do at least another month because I have some like issues with my knee collapsing, and we really need to work on hip stability since we spent a lot of time working on my SIJ, you know, whenever we could have been working on my hip right after surgery and the few months, you know, after surgery. So I'm gonna show you guys what I worked on there today, and yeah, so check it out. First things first, we did some strength testing today. I did a couple of positions, as you can see here, laying down, where my PT Emily tested some things. I'm not a PT, so I don't exactly know what she was doing, but I can tell you that she was happy with the outcome. Then we went over to the treadmill where I held on while I held up each leg for 30 seconds, testing, I think, hip flexor strength here. After that, we moved over to do a hip flexor exercise, and I do want to mention before this, we massaged my hip flexors really well, and then I had 4-pound weight on one foot, and I lifted it up for 3 seconds and down for 3 seconds. I did that 10 times on each side. After that, we went over to work on my collapsing knee issue, which they call valgus, and I had a block that I was stepping up onto that you can't see. And then my PT came over and she put a strap around my knee, so basically I would be fighting her to keep my knee from collapsing in. And one thing I love about this PT place is that they always get other PTs involved to help you get the best care. And there's another PT coming over to analyze what I'm doing and help assess, and they figured out that I needed a smaller step. So we got a smaller step, and then I did that about 20 times just to keep practicing. And then I went over, and I apologize for the bad camera angle here, but I pushed my knee against a workout ball on the wall and stepped up onto the same step. I would say it was about 4 inches off the ground, and pushing my knee into the workout ball kept my knee from collapsing inward. I did this about 20 times. Then we went over to the TRX straps, where I basically squatted down and then came back up and tried to keep my knees straight, and I was looking in a mirror the whole time trying to keep it in line and not collapsing in. My PT then got the same strap so that I could practice fighting it out to the outside. After that, we went over and I kind of squatted down. You can see I'm holding on to a pole for stability, and the goal here was to keep my knee in line with that cone. And so I did that about 20 times. And then, since I haven't started running yet, and a lot of people do run by this time in their recovery, I'm just a little bit more nervous because of my SI joint dysfunction. I was on the slider and I was just jumping up and down with a little bit of tension, basically getting my body ready for shock absorption and to kind of practice the motion of running. And my PT and I went over after this, and I don't have film of me jumping up and down without this, just on the ground, kind of getting ready to like land lightly on the ground in the motion of running. Okay everyone, well that's a wrap for today, 6 months post-op. And I know I say this every time, but honestly, if you have any questions, if you're going through something similar, please don't hesitate to reach out to me. I would love to compare experiences and help you. It's always a really long journey, and I know how exhausting it can be. So please don't hesitate. If you haven't subscribed to our channel yet and you'd like to, I'd love to have you. And if you liked this video, or if you're a hip labral tear person like me, or just on your healing journey, hit the like button, and I'll see you next time.